If you look at it from the two partisan sides, you see a slightly different perspective. The Democrats tend to favor congressional action on making sure that all Americans have health insurance, although a significant number are concerned about costs also. There's still 28 million Americans without health care insurance. Republicans favor congressional action on lowering the amount that they pay for health care, but both sides agree that something must be done. If you look at the comparison of Medicare for All proposal with public option in these surveys, you see some interesting contrasts. On your left is the Medicare for All survey. It's favored by 52% of all polled, 77% favorable among Democrats. You see, I'm talking about strongly favor and the somewhat favor colors. 53% favorable among independents, and 19% favorable among Republicans. If you look on the right, you see the Medicare option survey. It's favored by 69% of those polled, 87% favorable among Democrats, 72% favorable among independents, and 41% favorable among Republicans. Now, language and words obviously make a difference in how people react to these various proposals. And as you can see from this, if you call this Medicare for All, the response is generally favorable. If you call it socialized medicine, you get a big negative response. And you're going to see this reflected in speeches and sound bites over the next year and a half. Now, let's talk about cost. As Dr. Fleming has shown you, the national health care cost for health care is almost $4 trillion a year. The range of estimates for the Medicare for All, that's the Senator Sanders plan, and that's what we're going to talk about, not the options. The Senator Sanders plan goes from an increase of 17% above current status quo to a decrease of 10%. This is from the RAND analysis, which is kind of in the middle and shows an increase of about 2%. Now, on the status quo bar at the top, now this is taken from CMS data. That's the National Health Expenditure estimates from CMS, so it's government data. The federal government pays about a little over $1 trillion for health care. All told, government agencies pay almost $2 trillion for health care. Now, that's federal government, state governments, Medicaid, all the different services coming out of the states and the feds, cities and counties paying health insurance and everything in, the tax deductibles and deductions and everything else. The federal government pays about $1 trillion. All other governments all in pay about half of this cost. The public pays the other $2 trillion, the yellow bar paid for by the public. That's pretty evenly split between the employers that pay about $1 trillion for health insurance premiums and the public that pays about $1 trillion out of pocket. Now, that's co-pays, deductibles, and everything else that the public pays for. We're all paying for this $4 trillion already. It's just whether we pay for it in taxes or pay for it out of pockets or pay for it with insurance premiums paid by employers, which is in lieu of increase in wages. And you also have to add on top of that, there's a $280 billion tax benefit to employers for these premiums. So there's a tax benefit baked into this to the employers that's not usually talked about. So we all pay for this one way or another. The bottom line is that Medicare for All, the RAND estimate, has the federal government paying the bulk of this $3.5 trillion and the public paying a small amount out of pocket. Now, that would imply that you'd have to raise taxes to pay for that. Now, raising taxes to this level is not a trivial event. The voting public has not been very favorable to presidents or to political parties that raise taxes to this extent. So I realize that's not a trivial event at all. So what's driving this? The drivers for Medicare for All, and most of these Dr. Fleming has already mentioned, the cost of PPO health insurance all in, this is co-pays, deductibles, and everything else added on top of the premiums, is $28,000 for a family of four. That's according to Milliman. The median income is about $60,000, so families cannot sustain health care without a subsidy. Percent of Americans who think high-quality health insurance should be the top priority, 68%. Employers pay, again, more than 240% more than Medicare for the same services. Trust in American health care has dropped precipitously since 1977. 71% of respondents think the American health care system is a state of crisis, and the percent of Americans who remain uninsured is 28 million. So what are the drivers against this? Why don't we do it? Well, here's the reality. The American health insurance industry is a $600 billion enterprise. United Healthcare, Anthem, Aetna and Anthem alone employ over 364,000 people. The hospital profit margins, we hear, were declined to a negative 9%, with a loss of $86 billion to hospitals and several million jobs lost. And in most communities, hospitals are the largest employer. So this has a real economic impact across middle America. The biopharmaceutical industry is a $1.3 trillion enterprise with over 4 million jobs. And the big line there is healthcare stakeholders in 2016 spent over $500 million lobbying Congress. You can be assured they'll spend much more than that in 2019 and 2020, and that does not include the direct contributions to political candidates, to PACs, direct advertising, et cetera. So there's major financial forces resisting this. Plus, Americans oppose giving the government too much control over health care. We're still kind of squeamish over the government. 61% oppose that in a recent Kaiser survey. And 60% of Americans oppose eliminating the role of employers in health care. We have this concept of, we don't like it, but don't take it away from us. And that's a tough hurdle. And the percent of Americans who oppose a tax increase to pay for Medicare for all is 66%. Against raising taxes is a big political struggle. So what's going to happen? Well, here's what's going to happen. I don't know. But here's what you ought to watch for. One, voters are positive about Medicare, and they're open to options to expand it. Actually, the public that has Medicare likes Medicare better than the public that has commercial insurance. And however, Medicare, they're not positive about more taxes to cover it. And Medicare for all is not achievable with a split Congress and administration. That's pretty obvious. If employers have health insurance, they like it, but not their insurance companies. The 2018 midterm elections told us the health care cost is an issue, especially the cost of health insurance and drugs. So that's a major issue for the voters. Pre-existing condition clauses is important. We learned that from the 2018 elections. So pay attention to the federal case, the case from going through the federal courts now to repeal the Affordable Care Act, which is being advocated for by the administration, because that could have major impact if pre-existing conditions and other benefits that most commercial insurance patients have now, and to think that we're going to have a congressional solution to that before the next election is pretty unrealistic if that gets repealed. And then the elections midterms told us that they're open to Medicaid expansion. 3 states by referendum and 2 states by electing governors who were supporting it. There are options on the table to fix the Affordable Care Act and incorporate a Medicare option, including Medicare Advantage. That almost sounds like a bipartisan solution if we had lived in a bipartisan world. And then finally, what will CMS, Congress, the providers, and insurance companies do to lower health care costs? And they all are working on initiatives, and they're all advocating lowering health care costs, but the proof will be whether any of this is carried out and is successful. And finally, polls tell us that 49% of respondents said they've heard little or nothing about Medicare for all, and 64% have heard little or nothing about a public option for Medicare. So the vast amount of people that will be voting for this will be voting for something based on emotions and sound bites and gut feelings, and not about real detailed information. And as you can see, this is pretty detailed to get through to the average American voter. So that's where we stand now, and we'll stay tuned.